staffing shortages, a lack of beds, and inadequate care in the maternity ward at the Jim Pattison Children's Hospital. All concerns being raised by the Saskatchewan Union of Nurses.
They don't have enough staff to keep up with the number of patients that are coming in, these new moms that are coming in, and the complexity.
Bryce Boynton says staff are seeing an increase in the number of expectant mothers presenting with comorbidities, such as hypertension, diabetes, and syphilis, making their care more complex. He says Regina General Hospital's maternity ward is facing similar challenges, along with issues around outdated equipment. The union recently sharing anonymous letters from its members on social media. One nurse wrote, quote, "Our electronic fetal monitors are becoming so outdated that monitors completely stop working while being used on a patient. Equipment malfunctions. We are running from room to room to find working equipment." Another nurse said patients are being denied basic care, waiting in waiting rooms for hours, delivering in triage beds, and being denied epidurals because of capacity pressures. And a Saskatoon nurse said nurses left solo with 8 prenatal patients when usually there are 2 nurses for that same load. Boynton says addressing staffing issues needs to be a priority.
Let's reassess our staffing availability. Let's focus on the recruitment and retention, but primarily that retention. And let's talk about nurse-patient ratios.
The Saskatchewan Health Authority acknowledges the situation and says an increase in deliveries, vacation time among staff, and illnesses contributed to the shortages in July, and that birth and staffing levels returned to normal in August. It did not address claims of equipment issues at Regina General Hospital and says Jim Pattison is outfitted with the necessary equipment. It adds patient safety remains a priority, something Sun says it's also pushing for. Stacey Hein, CTV News, Saskatoon.